In this study, we evaluated a total of 117 patients who had metastatic castration-resistant prostate cancer, and we treated them with actinium-targeted alpha therapy. So these patients have advanced prostate cancer, and targeted radionuclide therapy with alpha particles is different from beta particles, which is like very well known, known as Pluvicto currently. Alpha particles are greater in size, have greater linear energy, and they need less hits to kill DNA compared to alpha therapy. And also the ligand in this therapy is different. It's an antibody ligand, has greater captation in the prostate cancer cell and greater retention compared to small molecule ligand. We looked at baseline PSMA PET with gallium-68, PSMA 11, and also we looked at follow-up 12 weeks after therapy with actinium targeted radionuclide therapy. And we compared that, what we found in the images, SUVmean, SUVmax, and total tumor volume with outcomes. And we tried to find a correlation between the biomarkers, imaging biomarkers, and the outcomes in terms of PSA 50, that is biochemical response, overall survival, mainly. What we found, so for this trial, for this project, this is a post-hoc analysis of 4 clinical trials at our institution, early phase clinical trials. As I mentioned previously, we included 117 patients, and they had like 4 different clinical trials. 2 were single agent of actinium, and 2 were actinium in combination with other therapies. So one of those combinations was with lutetium-177, and the other combination therapy was with pembrolizumab and androgen receptor pathway inhibitors. So in terms of results, what did we found? We found that at baseline, SUVmean and SUVmax were associated with biochemical response in terms of PSA 50. And when we looked at the follow-up images, and we determined the percentage of change between baseline and follow-up, we found that total tumor volume was associated with PSA response. So the higher the difference between baseline and follow-up correlated with biochemical response, like higher odds of achieving at least 50% decline in PSA. In terms of overall survival, we found that SUVmean and total tumor volume were associated with overall survival. So higher SUVmeans and higher total tumor volumes were associated with a protective effect, and patients had better outcomes, like they live longer compared to lower total tumor volume and SUVmean. And at follow-up, we found that total tumor volume was associated also with overall survival. So the greater the difference between baseline and follow-up in total tumor volume was associated with longer survival. And interestingly, also we found that prior chemotherapy was associated with higher hazard ratios, and p-values were statistically significant. In terms of adverse events, because this is a very frequent question from our oncologists and urologists, so we found also that at baseline, higher total tumor volumes were associated with higher grades of myelosuppression, mainly anemia. But we also found that higher total tumor volumes at baseline had lower risk of xerostomia and nausea. So what this tells us is that patients are having a PSMA antigen sink effect, that as higher their total tumor volumes are their SUV means the targeted radionuclide therapy is going to these places and is not going to other vital organs such as carotids and glands. So this tells us about the biology of the prostate cancer and the PSMA expression, and how the therapy goes to the tumor and avoids other vital organs. This is also important because now we can better select patients for this therapy. So what we are trying to prove here is that PSMA PET at baseline and follow-up can be considered a biomarker, and we can better select patients both for clinical trials and eventually for treatment.